active consultants, as well as the residents and interns. Good afternoon. Murag katulgon man mo. Maayong hapon. Okay. So murag natunga, no? By age, okay? From this point, okay? So you can see from here, natunga mo by age. The young ones are here and little bit senior are actually here. Opo. So we can also see it's divided by weight, no? So, okay. So, again, maayong udto. So, who knows how to play basketball here? Basketball. Who knows the concept of basketball? Okay. So kayo dito, wala ho kayong alam na palaro ng basketball? It's like this. For example, this is the basketball team. And then tomorrow, there will be, okay, a basketball tournament with some other team. And somehow, you guys, as players, don't know the rules of the game. Because, for the reason, wala lang. You just don't know the rules. Question, what is the probability that you will win tomorrow's game? 50%? 50%? Okay? So, may star player. But then again, nobody knows the rules. So the probability of you guys winning the game tomorrow, sa tingin ho ninyo, you'll never win. Okay? So, yan ho ang nangyari dito. Okay? You're engaging with social health insurance, specifically PhilHealth. You've been engaging with PhilHealth and you guys don't know the rules. If meron man, it's basically based on assumption. Then again, we don't blame you or I don't blame you because it was never taught to you. Di ba? Nakuha niyo po? So, ito lang difference din. From here, yung kaupo dito, nakatingin sa ganyan pababa. Ito mga dito, nakatingin sa taas. So, okay. So, my name is Doc Ben. Just a little story lang. After PhilHealth po, I created this consultancy. I was with PhilHealth for 15 years. Now, in the next few slides, some of you, nakita nyo na ho ito. Okay? So, I'm a self-proclaimed PhilHealth coach. Okay? My competency is on clinical claims management, accreditation, PhilHealth legal issues, and UHC. My clients po are hospitals. Okay? So, this is what I do. I help hospitals, okay, provide sustainable claim solution for the hospitals. Now, next. So, the promise here is our task or my task as a consultant is to help you, okay, in your understanding, okay, and PhilHealth related issues. Okay, organizational efficiency, would like to train to prepare, okay. In my other clients, okay, we provide legal strategies po, okay, against PhilHealth or towards PhilHealth. So, ito po. After 15 years po in PhilHealth and 3 years in this consultancy, ito lang ho talaga ang problema ng hospital at doktor. Okay? There is a long history of miscommunication and false assumption. Dito lang po umiikot yung problema. Okay? Many of you are not informed. Okay? So it is very critical that the next few years of engagement ninyo with PhilHealth, you should know how things run. Lalo na ho ang konsepto ng UHC. So, the problem is very simple. It's basically this. Be it government or private hospital, big or small, level 1, 2, 3, ito ho yan. There is a financial issue, there are returns of claim, there are denied claims, there's conflict within the facility, compliance issues, and there's poor collection. So as what our medical director has stated, okay, it really affects the cash flow. Now, very specific for you or in this institution is this. You have denied claims. Tremendously, sobrang dami. You have return claims. You have a history of accreditation problem. Quite surprisingly, nobody is on top. Okay? There's poor monitoring. Your revenue, more than 50% comes from PhilHealth, but there's no PhilHealth expert here. It's very ironic. Your claims turnaround time is 59 days. So, unsa ning 59 days? Kasabot mo sa claims turnaround time? Kasabot mo? Where are the residents here? Kamo? Sila? Bisita? Residents din. So, what's 59 days? From the time that the patient is discharged, the hospital has 60 days to submit it to PhilHealth. That's the rule, mandate by the law. And then PhilHealth has another 60 days to pay the hospital. Now, if you are running a hospital, naturally, you would want your revenue to be early. Di ba? Sana mabayaran kayo ng earlier. So, the earlier you give it to PhilHealth, the chances of you getting paid is also early. Now, in this institution, it takes 59 days. Okay? Ganun ho katagal. So mamaya iisa-isahin natin yan. Okay? Next, there's information based on assumption and you have problems in revenue. Now, again, to reiterate this, napakita ko na ito sa iba, what's happening? It's like this. Okay? Payers have increased their demands on hospital to provide support on all healthcare services that you provide. So, to rephrase it, PhilHealth has increased its demand for you guys to provide proof that you've delivered services. Kung naggamot ho kayo ng pasyente, PhilHealth will ask for a proof before they will pay you. Now, this asking for proof or support will definitely double when UHC is operational. Okay? Now, let's flip the coin. For you guys, the physicians, you don't want to be distracted with this documentation. These are nuances for you. Diba? That is the reality. So that is very sad because the situation right now is that PhilHealth will become the biggest payer and he, or rather PhilHealth, will play it this way. It's now the power of the purse. They will demand whatever they want, okay, because they have the money. Ang problem lang po, hindi ho talaga naka-mindset yung mga doctors natin to make documentation. So yun ho ang ating medyo weakness, the documentation part. Now, when I was invited here, the desired outcome po is this. Okay? But the ultimate outcome that we want is that no return, RTH ho is returned to hospital, no denied, no legal problem with PhilHealth, increase the revenue, and ultimately from 59 days, okay, gradually we can decrease it to 40 and probably 30 and hopefully by 15 days processing time. That is the desired outcome. So, just a little background. Let's call this the patient journey, or to make it more tasteful sa inyo, it's like the anatomy and physiology of claims processing. Okay? So, basic claims processing or processing 101. When the patient comes in, be it from the clinic or the patient walks in at the ER or the outpatient, once the patient enters the hospital, he is seen by the following people: medical guys, or the doctor, the registered nurse, the ancillary, okay, medtech, and the support group. Now, these people, okay, be it frontliners or healthcare providers, will only give two things to the patient. Duha lang ni. Dalawang bagay lang po. It's either they give supplies in a form of medicines, in a form of food, room and board, okay, or services. Services from the clinician, the doctor, the residents, the intern, the nursing, and the ancillary people. Now, the supplies and services is then converted into money. It's collated, magiging bill ho yan siya. Yung bill, okay, kapatid lang ho yan ng claim. Yung claim, ipapadala po kay PhilHealth. Okay? So, the bill or the claim with the ICD code is then sent electronically to PhilHealth. Then PhilHealth will pay. So that is now the simplified version. Dalawa lang ho, supplies and service. Now let's go to a little bit deeper, okay, of the anatomy. So now this is it. Mabasa ho ninyo? Hindi, no? Pwede ho kayo sa harap. Baka may premyo ho ang medical director. So, it's very critical that you need to understand this. This is the journey. It all starts with patient registration. Once the patient comes in from the clinic or walk-in or be it the ambulance, they will always register. Okay? So the guys there, ER clerk, the resident, or whoever it is, they need to do their role. After registration, the patient is admitted. Okay? The patient is then given the services. Ito ho yun, the delivery of services. So it comes now in a form of supplies, medicines, diagnostics, okay? Your presence, the food, room and board. It's supplies and services. Now, all of these things is captured on a piece of paper. It's called the clinical chart. Kuha niyo po. This is where you order your thing and then it's executed by the nurses. From data capture, and then you order the MGH, okay? All the information is converted into an ICD code. The code is now the key to PhilHealth case rate. So, one of your top illness here is pneumonia. What is the ICD-10 code of moderate risk pneumonia? May idea ba ho kayo? Okay, it's J18.9. So, it's 15,000. A certain percentage goes to the hospital and a certain percentage PF. Now, from coding, it is billed. Babayaran ho ng patient and then the claims are prepared. And payment by PhilHealth. And once payment, posting and disbursement, if the claim is denied or returned, someone should focus on it. So, malinaw po yung ating anatomy ng claims processing. It's pretty basic. Okay lang ba? So, the gentlemen and the ladies here, naintindihan nyo po? Okay, now, let's go more deeper. Ganito po. Patient registration. It happens in ER, OPD, or in a clinic. Okay? Pagpasok po ng pasyente, again, there is this delivery of services wherein interns, clerk, residents who are frontliners start to order their medical procedures and assessment. Okay? So these things happen in the ward, okay, OR, DR, and OPD. This is where the services are given, medicines and diagnostics. Now, again, all those things are captured. For this institution, if it's OPD, it's captured in what you call, what card is that? Ano po? Yung card sa OPD, anong tawag nyo doon? The yellow card. Okay. So it's captured. If it's an inpatient, nasa chart. Now, after writing all of those things, charge capture comes in. So whatever you ordered, the nurse executes it, and there is a system wherein the supplies are taken somewhere and it must be captured because charges will be collated. Charge capture. Kasama ho sa charge capture yung pangalan ninyo, pati yung PF ninyo. Okay, malinaw. Then once you decide to discharge the patient, the consultant will now make his final diagnosis. Ideally, my PF. Okay, ideally. So, after ho na to, pag na MGH order na at may PF na, it is evaluated ho sa baba, sa office. It's evaluated. The final diagnosis will be the basis. The charges will be collated. Your names will be there. And if you indicated your fee, it will also be there. Okay? And it will be coded. Why? Because the coding will now determine the PhilHealth benefit package. Okay? So kung mali ho yung code, mali yung package. So, after ho na code, okay, may clearance. Then the clearance goes back sa floor na pwede nang mag-uwi. The bill and the statement of account, okay, all of the information is collated and signed by the watcher or the patient. And there's physical discharge. Now, ang nangyari ho dito, nag-register, delivery of services, charge, capture, okay, nag-diagnose kayo, collated, and the patient went out. So let's say after 2 to 3 weeks or 30 days, the chart, after passing through medical records, goes to the claims office. Days after discharge, all of the information, okay, you ordered, execute, collated, your name, okay, all of it, okay, goes into here, sa claims office. It's converted into a CF4 or rather a CF2, Claim Form 2, Claim Form 3 for specific illnesses, CSF, okay, dito ho kayo pumipirma pati ang pasyente, and the most controversial, CF4 and the statement of account, the SOA. Now, after collating all of those things, PhilHealth people, which is their task, is only to evaluate it and prepare it. Nothing more, nothing less. If all is well, there is now electronic sending to PhilHealth, the e-claims. Papunta ho sa PhilHealth. So, eto ho yung medyo malalim. Okay lang po? Kaya pa? Okay. The denied claims, ito ho yung mga common. Okay? Sobrang dami ho ng reasons, but I only took the common ones. Exhausted 45 compensable days. Is it PhilHealth-induced or hospital-induced? Again, there's always two. What is 45 days? Now, to give you a crash course on PhilHealth membership, it's like this. If you are a PhilHealth member, you are allocated 45 days of confinement if you are a member. If you have a dependent, tatlo yung anak mo, 45 days shared sa mga dependent. Oh, yun, di ba? So, ganun yun. Now, yung pasyente mo, dialysis patient, yung 45 ba, kulang, tama lang, o what? Kulang. Di ba? So, wala ho kayong maa-avail. If your patient was previously admitted 40 days sa Digos, 20 days dito, hindi din mababayaran ng buo yun. Kuha niyo po, 45 days. Member, 45 days, dependent hati. Now, yung pasyente, pedya. Pero yung kapatid ho, dependent din. 42 days naubos niya. Then na-admit yung isang dependent. So, ubos din yun. Okay? Yan ho yung 45 days. Non-compliance to the standard of care. So, ito din ho yung napansin ko sa inyo. The lack of standard. Ang standard of care ho, drama lang ho yan. Ang isang pangalan na yan, CPG. If you're treating your patient, managing it, pneumonia, make sure it's a little aligned with your CPG. So, pardon for the residents, that's why naniningil ho ng CPG. Okay? The standard of care is being used sa pag-analyze ho ng CF4. Yung CF4, ito yung kalbaryo ng residents. Okay? So every time you diagnose specific illnesses, PhilHealth is now using an algorithm wherein they've set qualifiers. So may system, pati may manual. Kasi electronic sending ho, di ba? Kung 10 dyan ay pneumonia, ang system na ho ang magsala. Kasi may criteria na eh. Saan nakuha ni PhilHealth yung criteria? Sa CPG. So when your diagnosis is a little bit off, okay, not based on certain standards, they will ask for a justification. Hindi ho kayo kakasuhan, justification. Now, the sad part here, if your justification is not justified properly, then the story will be more longer. Violation of single period policy. Now, itong policy ho na to, it's like this. To simplify it, the patient was admitted sa Davao Adventist for pneumonia. Then, na-discharge, nagtawid dito. Okay? Again, admitted with the same illness. Hindi ho mabayaran ang isa doon. So the violation of single period policy is this: admission, readmission of the same illness in 60 days. Hindi ho yan babayaran. So this is very critical for the frontliners, residents and interns. Ma'am, sir, na-admit na ba ho kayo? Oo, ano yung iyong diagnosis? Okay? Kuha nyo? So ito ho, violation of single period policy. Ito, case rate claim attended by not accredited doctor. Very simple, the attending physician forgot to renew their accreditation. Once hindi ho kayo accredited, denied yung claim. Yung buong claim, kasama ho ang hospital. So yun ho. So I'm not quite sure what is the policy of the hospital in instances like this. Okay? So, double filing, same-day confinement, okay? So meron ho ito. Usually clerical ito, but this seldom happens now. The no CPSA attached, okay? Ito ho yung sa cataract, the pre-approval, so required medical documents. Ito ho, case not compensable. There are certain illnesses wherein PhilHealth will not pay it. So you also need to be very mindful on this. Now, return to hospital. Ito ho yung 13M. Okay? So, properly accomplished original PhilHealth claim form 4 with errors encountered in CF4. Okay? CF4 ho ang issue. Okay? It's XML. Original claim form 2, not properly accomplished. Properly accomplished original PhilHealth claim form 2, RVS ICD code not found on discharge diagnosis. Na-return. Required laboratory results. Unlike ho dati, minsan yung laboratory hindi na malaking factor. But when CF4 came, required na po. Basta may lab. There are also instances wherein the patient was admitted somewhere or nagpa-OPD, na-admit dito, actually, yung outpatient na lab pwede din gamitin. Required labs, cataract pre-authorization, no signature of doctor in Form 2, the CSF. Ito po, laterality, not indicated for procedure that requires laterality. Laterality means left or right. Okay? Wala hong laterality. Required documents is unavailable, incomplete, inconsistent, and unreadable. Valid ID of authorized signatory. Okay. Now, yan ho yung common. Okay? Sa 4 na buwan. Now, fresh from the frying pan, galing ho ito dito. My friends in PhilHealth. It's like this. The top 10 RTH. It's so ridiculously simple wherein nalulugi ho talaga ang hospital. Hindi ata. Common ho ito. Required claim forms, wala. Or kulang. Required laboratory result, yan yung sinabi ko kanina. CF4 ho kasi ito. Required document is unavailable, incomplete, inconsistent, and unreadable. Other documents required are not there. Errors encountered in XML format, IT related. Required medical documents, discrepancy. The CSF po, not properly done. No attached surgical or operative technique. Yun ho. Pagpasok ko sa PhilHealth, ito yung problema. Nakaalis na lang ako, ito pa rin. No attached, properly accomplished CF2. Okay? Top 10 denied. Ito po. It's ridiculously simple. inconsistent data. Okay? Mamaya ho, ipapakita ko sa inyo kung ano nangyari. Ang dami ho na to, inconsistent data. Confinement not within the accreditation period. Okay? Denied due to non-compliance. Sinauli na ho ni PhilHealth, ni-return ni PhilHealth because PhilHealth is asking for something else. And then what the hospital gave back was not the one. Yun ho yun. Filed beyond 60 days. Okay? Bakit? Okay? Double filing, violation of single period policy, case not compensable, 45 days, denied ang legal, not attended. So it's basically the same ho doon sa 4 na buwan. Okay? Common issues. Ito. Inconsistent attending physician in the forms. Okay? CSF, SOA, CF2. Iba-iba ho yung doktor. Okay? Annex 7 is the laterality issue, what I explained kanina. Ito po, neonatal sepsis, complete history of present illness. It's a CF4 issue. Okay? The CF4 ho talaga is the make or break right now. Next. Oh, thank you. So we're done with the anatomy and physiology. Okay? This is more of the pathology side. Issues per area. Now, again, the desired outcome is this. No return, no deny, no legal. Revenue should go up from 59 days, sana 30 days. Again, this is the anatomy. Okay? The problem is this. The information that you write or you've gathered, tatlo ho yan. They are incomplete, it's incorrect, and it's inconsistent. From patient registration at ang journey ng pasyente tumagal sa taas, nag-order na kayo yung labs, capture, okay, nag-MGH, pag-evaluate ho, ang diagnosis apektado, ang code apektado, incorrect, incomplete, inconsistent. So, eto ho nangyari. Because of the inconsistencies, it's incomplete, okay, and it's inconsistent, the information that's being collected and goes to CF4, CF3, CSF, SOA is being validated. Now, the claims people, not that I'm defending them, in trying to protect the interest of the institution, they do some minor editing of the information that you got. Kasi mali ho eh. Why? Because when they try to call you, be it residents or consultant, you're not available. Yun ho. They try to validate, edit it, and that's why it goes to 59 days. Wala ho silang ginawa kundi magtahi at magtahi at magtahi. So in trying to tahi everything, paminsan, parang boxing. To a point wherein the claims people become so irritated because it's been going on for several months and years. Muana sila. Pwede ba nato i-change na, Doc? Pero kinsa may mubayad sa disbalance, ikaw? So, it comes something like that. Okay? Now, let's do it step by step. These are issues per area wherein dapat per area umabot na po sa pinakadulo at hindi ho na bago. So, the red ones are for the medical. Again, the outcome is no return, no deny, no legal, increase revenue 59 days to 30. Patient details are wrong. Poor reliability of information. Single period policy missed out. Patient registration pa lang, tinatanong na ho dapat yan. Okay? Benefit 45 days allowance, missed out. Okay? Again, I don't blame you. You were not trained to ask. Okay? Information coming from AP's clinic is inaccurate. Oh, by the way, all of this came from people who yun ho ang challenge, Doc. Marami hong sinungaling. So, still, that can be prevented because it takes po how many encounter at makita ho talaga dapat ng nurses at ng resident. So, again, the information was taken. It's a root cause analysis. Nag-interview ho ako per batch. Nursing service, residents, interns, and other offices. History PE, inaccurate. So, clerk, intern versus the residents and versus the consultant. Bakit ho? Ano ang value na to? Again, sa CF4. Kung ano ho yung ilalagay sa CF4, hindi ho match doon sa documents. Now, chief complaint, no entry or a dot. Sino sa inyo may idea itong dot or period? Hindi nyo alam? Yung dot. O, ito yung dot. Dahil wala hong entry, dahil hindi na-interview ng maayos, wala hong chief complaint or diagnosis. Ang system ho nila sa baba, which is connected ho sa lahat, it will not run if there is an empty ang entry. So may agreement na just put a dot and it will run. So naglagay ho ng dot. Dot, dot, dot. Pauwi na lang yung pasyente, yung dot nandoon pa rin. So, ang claims people, anong chief complaint? Okay? Chief complaint, no entry. Admitting diagnosis, dot. Nakuha niyo po? Now, don't get me wrong again. Our PhilHealth people will follow up, will validate, and will try. Iniiwasan ho nilang mag-edit, pero trying to protect the institution na hindi ho ma-deny, na may konting editing. To be honest ho, may konting editing pa sa history kasi yung history ho hindi malabo. Parang galing sa moon. Okay? Admitting diagnosis, no entry. Incomplete information. History PE does not match. Okay? So, ito ho yung classic example ko. It did not happen here, but it happened in one of my clients. So, on trying to interview the patient, may orders ang doktor. Ang management po is leaned on vertigo hypertension. So, the resident, ma'am, good afternoon, blah, blah, blah. Okay. Nahilo ho ba kayo? Wala man, dok. Okay, blah, 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 blah. Ma'am, nahilo ho ba kayo? Wala man, dok. Kasi dizziness ho yung complaint. Blah, 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 blah. Ma'am, sure kayo, hindi kayo nahilo. Ngayon, dok, nahilo na ako. Sige mo tanong. So, ano nangyari? Ito yung kwento ng resident. Sabi, dizziness. Nakuha niyo po? So, may problema. Again, issues ho, from patient registration, it goes up to the end of the journey. Okay? Ito, hindi to inyo. Pero I would want you to know this because this is very important sa inyo. Wrong or inaccurate MD on chart. Sino naka-experience na to? Di nyo alam, no? Kasi hindi nyo binasa. Okay? Incomplete name of MD on chart. The MD has been doing his rounds, but the name, his name, did not match. Di ba? Hindi pala. Ang pangalan pala doon iba. Ang nakakita pa ho, yung na-discharge na. Di ba? So, wrong MD po has impact on the PF. Can you just imagine the task? If this will happen every day, they will keep on calling. Tatawag, ang sabi nga nila, hindi man kami dito claims office, Doc, hindi man kami billing call center ho kami. Hi, Doc. Doc, your patient. Call center agent daw ho sila. Now, eto ho. It adds to the confusion. Patient registration, though this is not for you, nice to know. Ito, MD, not accredited. By the way, the green ones, these are issues that reflect the denied and the return. Okay? I'm just trying to state that it's here. MD complete name not specified. It adds to the confusion. So, sa sobrang dami hong doktor, hindi naman nila alam. Kahit sabihin natin, pedya, ubi ba yan o what? It adds to their task. It's not their task. That's why it's 59 days. So, all of this can be prevented in patient registration alone. But whose task is this? Di ba? Are we going to give this to the nurses, to the clerk, to the residents, or to the interns? It's everybody's task. Admissibility criteria not clear. It's critical to CF4. Now, this is very scary. I've talked to one of the department here. I was discussing the admissibility issue. So ang tanong nila, Doc, paano ito? Many of our patients here are not actually admissible. Oh, di ba? Yun ho ang problema dahil si CF4 is concentrating on admissibility. Doon ho kayo nawawala. You're focusing 90% on the course in the ward wherein the tool of PhilHealth is concentrated on admissibility. I'm not saying course in the ward is not important, but admissibility is very, very important. So, admissibility is simply based on the CPG. So there was this instance po sa meeting ng MEC, I asked if the CPG is being followed. Well, natural. We are a training hospital. Oh, tama ho yun. My next question, who's monitoring it? Yun ang hindi ko masagot. So yun ho, there is this assumption that we are following the CPG. Magkakaproblema ho tayo pag nag-audit ho si PhilHealth. Okay? The CPG is the standard of care. Okay? Ito po. Errors affecting billing and claims. Charge capture. Incorrect, incomplete, inconsistent. Yung palaman ho doon sa dokumento, inconsistent. Not charged, wrong charge, delay charge, double charge. Again, this is not for you. But once the PhilHealth team will see this, it's a rework. Atras ang trabaho. Okay? Rebill nila yan. Ito po. Delay in billing again. Unused but billed. Used but not billed. Package supplies inconsistent, it ends up overbilled. Okay? So, ang pasyente ho galit. Once they try to validate it, the nurses cannot explain. Now, very specific for the consultants and the residents. There is this habit that you do. You add the diagnosis, okay, or you change the diagnosis. Na MGH na bill na, then you add this. Then you change. Okay? Ito pa po. Ito talaga. Dito, bulagaan. Inconsistent doctor. Pre-approval, Dr. A. Actual surgery, Dr. B. OR Tech, Dr. C. It's very inconsistent. So ang tanong ko nga dito, did you ever validate it? Because this is just the younger brother of fraud. Okay? So some of these are innocently done. Okay? Ito po ang isa. Meron akong memo. Okay? PF. Memo na ho. It's not followed. There's no PF. There's wrong PF. Since there's unclear PF, magpi-PF ho yung mga tao sa baba. Ito ho ang effect. Ang late naman ng PF ko. Kuha nyo? Hindi ka matawagan eh. Sunod, meron pa isa. Ang laki mo ng PF ko, ba't naman ganyan? Oh. Okay? Sino ho naka-experience ng ganon? Wala. May listahan ho kami. So, can you imagine this? Can you imagine the anatomy? Nasa dulo na ito eh. And then they will do the rework. Okay? So, eto ho yun. Yung mga mali-mali ho natin, nandito na sa dulo. In fact, nandoon na nga eh. And then, you change the diagnosis. So, for the residents, in the event that meron ho kayong encounter dati at nag-argue ho kayo with the claims people, please forgive them. Okay? Okay? So, tao lang din sila. There are times, ang patient ho nakauwi na, dumaan na ho ang ilang araw, the consultant will not sign the PhilHealth document because the diagnosis is wrong. The consultant demands to change the diagnosis or the procedure. The moment you change that, it needs to be reworked. Uulitin ho lahat. Yung SOA, Statement of Account, uulitin. Yung ICD code, mauulit. Yung bill, mauulit. Nakuha niyo po? If you're running a hospital, your stream of income comes from two, PhilHealth and the excess or the out-of-pocket. Sa PhilHealth ho, medyo tagilid na, yung out-of-pocket, hindi pa kayo makakolekta, tagilid rin. So that's the rework. It's very important that you should know na may rework ho. So, part ho ito sa journey on claims evaluation. Okay? Most of the time, nakauwi na ho ang patient. Okay? Meron ding panahon hindi. IV charges late, hindi ito sa inyo. No charge, no IV charge, nasal cannula not charge, IV cannula not charge, X-ray charges late, charges versus carried out orders are inconsistent. O2 not done, surgery done but no OR fee. Double entry of newborn screening. Ito po ang para sa medical. Final diagnosis is unclear or not related to the medical management. Anong nangyari? We're playing basketball. Okay? There are rules for it, and suddenly the rules were changed. Di ba? So can you just imagine the catastrophe of the PhilHealth people and the billing people? Okay? Ang diagnosis ninyo is pumasok ho ng management o AGE, ang diagnosis ho, neuro. Okay? Incomplete final diagnosis. Ito po sa mga CS. Change final diagnosis by the resident. Okay? So hindi ho alam kung nagbago isip or inutusan. Resident, consultant, unclear if what diagnosis. So may antayan pa po. It adds to the delay. Is it urticaria or anaphylactic shock? Final diagnosis, parang may away ho. Resident and the consultant. Diagnosis, not compensable. Diagnosis, inconsistent in the documents. Diagnosis, incomplete, inconsistent, at meron hong mga no secondary. Okay. Ito ho. No anesthesiologist on the CS procedure. So, tatawag pa nila. Doctor, accreditation expired, no RUV, wrong RUV, no labs, labs done as outpatient was never documented. So ito ho yung mga maliliit na bagay na kailangan nating malaman. Okay? So, ito ho ulit. Gaya ng sinabi ko, from patient registration, nagstay na yung pasyente ilang araw, pa-discharge na ho siya or na-discharge na, dot or period lang ang nailagay. Anong nangyari? Final diagnosis is incomplete again. For example, indication of CS. Patient gender not known or it's not indicated. Inconsistent po ang final diagnosis. The face sheet and the OR tech. Hindi ho match. Incomplete yung OR tech. So, gumawa ho kayo ng major surgery, copy-paste na lang ho dapat yan, yung kinopy-paste incomplete pa. Okay? And paminsan ho yung copy-paste, ang kinopya nyo pati yung pangalan ng doktor. Nailagay ho sa ibang doktor. Okay? Discrepancy on time of admission. Si PhilHealth ho very particular on this. Kasi binabasa ho ng system. Discrepancy on final diagnosis. Attending MD, no signature. No signature of surgeon on OR tech. So, ang suggestion nga, dapat may policy. Discrepancy date of operation at OR tech versus the other documents. Discrepancy on discharge time. Discrepancy orders MGH daw, pero naman na transfer. Okay? Issue ho ito. Date of surgery, admitting diagnosis on face sheet, no final, incomplete diagnosis, specifically no Ballard scoring. Okay? Ito ho yun, yung yellow card. So yung yellow card, ito ho yung OPD card ninyo. Okay? So, since meron din hong PhilHealth services dito, kinakailangan ho ma-charge kay PhilHealth. Okay? Now, sadly, the yellow card, again, has no diagnosis. Dot lang sa system. Empty ang entries, there's no vital signs, no history, or incomplete history, no date. Ito hong pinakabongga. Missing yung yellow card. Paano mo sisingilin? Nawala yung document, wala na yung pasyente. Okay? Now, these little things actually matter. Again, claims processing. Previous admission is never captured. CF2 has no diagnosis. Itong SOA, not so much sa inyo, it's inconsistent, no signature, SOA has no signature after office hours, history ends up being fabricated. Ito po, do tanggap naman nila, meron talagang penmanship na hindi mabasa. Okay? CF4 is a disaster. Tanong ho ni Dr. Magno, sino ba talaga ang gagawa ng CF4? And to be honest po, the story of the CF4 is really a disaster. The CF4, PhilHealth calls it payment review. Before payment, it will be reviewed. The document, the claim form 4. Who's making the CF4? Okay, it's the intern. No offense to the intern. Several months back, I raised it. The future of lies in the hands of interns. So, we discussed it with the intern. Diba? Tayo, nausap-usap, no? Who was trained to do the CF4? 3%? 2%? The courageous guys, ito. So, sino nag-train sa iyo, Doc? Katong na ako sa Cagayan de Oro. Katong na ako sa Cebu. Katong clerk pa ko. So, yan ho yun. The prepayment was given to them. And then, nung nag-December, hindi na nagawa, nag-martial law ho si medical director and the chief of clinic. Kaya, ngayon, nasa residence na. But then again, after doing all of those things, there's still double handling. Kasi tinatahi pa rin ho sa claims. Dahil inconsistent. Okay? Now, so much of all the issues, what is very important this afternoon is yung take-home ho natin, the intervention. Ito po, ito ay isang panawagan, request, na sana maintindihan natin, teamwork ho ang kailangan dito. Okay? It's very critical that you guys will know PhilHealth is just an insurance corporation. Being an insurance, he only needs two kinds of information. These are the clinical and the non-clinical information. So, self-explanatory, the clinical, medical history, physical exam, signs and symptoms, medical surgical management, medicine, CF4 and other. Yan lang ho information niya. The non-clinical ho, which is not so much on you, these are for the clerk. Patient name, demographics, the address of the patient, PhilHealth number, charges, signature, birthday, dates, and many more. Yan lang ho ang hinihingi ni PhilHealth. Clinical and the non-clinical, bago ho kayo bayaran. Now, the next intervention is this. The 3C rule. Hopefully, when we're done, you get to go home, and please don't forget the 3C. The information that they want, clinical or non-clinical, it must be correct, it must be complete, and please, be consistent. So from the time ho sa patient registration hanggang sa paglagay ho ninyo ng PF at final diagnosis, it must be correct, complete, and consistent. Otherwise, matatagalan ho. Otherwise, mag-i-edit at mag-i-edit ho sila. Now, for the clinical equation, it's again very simple. The patient naturally comes in here with clinical problem. Tama po? Otherwise, they will not be here. So, there's the signs and symptoms. The signs and symptoms should have the corresponding clinical management. Yung management po sana, tugma doon sa signs and symptoms. Okay? Now, on the other side of the equation, okay, the signs and symptoms in the management, you can easily now derive the final diagnosis and the subsequent ICD code or the RUV code. It's that simple. If mali ho ang isa dito, tatamaan ho yung claim ninyo. Okay? So, there is really a need for copies of the CPG. The CPG po, try your best, hindi naman ho lahat, your top 10 illnesses. Your CPG will be the clinical standard. Okay? Intern, resident, and consultants, must be synchronized. Hindi ho pwede magkanya-kanya kayo. Kasi ang information ho magiging chapsuy. Okay? No charging of diagnosis once their sending clearance is done. Now, the MEC, if I'm not mistaken, has decided on this na kapag nag-send clearance na po, ang hiling ho sana is wala ng change of diagnosis. On very extreme circumstances, the recommendation was in the event that there is a need to change it, okay, you need now to talk to the medical director. Because once you change the diagnosis, it's a total rework. The CF4, you need to be trained on this. Okay, my request po is for the departments to kindly schedule it and I can teach you the tips and tricks of CF4. Again, as I said, it's ridiculously simple. Okay? Okay, just set a time and we'll see if we can schedule it. Please do not forget to ask for previous admission. Meron ho kasing mga instances na nandun na yung pasyente sa magbabayad na siya and then the window guy asks, "Ma'am, may previous admission kayo?" Meron. So meron ho mga additional requirements. So may conflict. Okay? Read before you sign. Accreditation po is a personal task. Check your name on the chart. Kasi baka nagra-rounds ho kayo, yung pangalan mali ang spelling. MGH order. Please, a complete diagnosis is needed. Indicate your PF upon discharge, please. Review or monitor the outputs of your residents para ma-synchronize ho. And please include PhilHealth concepts on your training. Because for this to be sustainable, once the residents are out, you end up now having new batch of residents with no knowledge on PhilHealth again. So the cycle will continue. Okay? Thank you at magandang hapon.